Home. It's where we seek refuge, comfort, and a sense of belonging. Yet, for many, housing conditions pose a direct threat to their physical and mental well-being. The impact of substandard housing on health is undeniable, weaving a complex tapestry of interconnected issues that demand our attention. From damp walls breeding respiratory illnesses to inadequate heating exacerbating circulatory problems, the very structure meant to protect us can become a source of harm. In this exploration, we delve into the critical aspects of housing that affect our health, highlighting the urgent need for safe, affordable, and healthy homes for all. A dampness, often invisible to the naked eye, can be a silent and insidious threat within our homes. Leaky roofs, inadequate ventilation, and rising damp from the ground create breeding grounds for mold and mildew, releasing spores that wreak havoc on our respiratory systems. Prolonged exposure to damp conditions has been directly linked to a range of respiratory illnesses, including asthma, bronchitis, and even more severe conditions like lung disease. Children with their developing lungs are particularly vulnerable to the harmful effects of dampness. Imagine a young child constantly battling coughs and wheezing, their small lungs struggling to breathe in a damp and mold-infested bedroom. This is the harsh reality for many living in substandard housing, where dampness silently chips away at their health day after day. When winter's chill sets in, a warm and comfortable home becomes more than just a luxury. It's a necessity for maintaining good health. Sadly, for many individuals and families, particularly those struggling financially, affording adequate heating can be a constant battle. The consequences of living in cold homes are far-reaching, as prolonged exposure to low temperatures can exacerbate existing health conditions like heart disease, stroke, and respiratory problems. The elderly and young children are particularly vulnerable to the cold, their bodies less able to regulate temperature effectively. In the UK, winter death statistics paint a grim picture, with thousands of excess deaths attributed to cold homes each year. These are not mere statistics. They represent real people whose lives were cut short due to something as basic as the inability to afford a warm home. Energy efficiency plays a crucial role in ensuring both a healthy home and a healthy planet. Well-insulated homes with double-glazed windows and efficient heating systems not only reduce energy consumption and lower utility bills, but also create a more stable and comfortable living environment. By minimizing drafts, cold spots, and temperature fluctuations, energy-efficient homes help to prevent condensation and dampness, reducing the risk of mold growth and associated respiratory problems. Furthermore, energy-efficient homes can contribute to improved air quality by reducing reliance on polluting fuels for heating. Investing in energy efficiency is a win-win situation, benefiting both our health and the environment. Overcrowding, a pressing issue in many urban areas, presents a significant threat to physical and mental health. When multiple people are forced to live in cramped quarters with limited personal space and privacy, stress levels soar and the risk of infectious diseases spreading increases. Overcrowding can exacerbate existing mental health conditions, leading to anxiety, depression, and social isolation. Children in particular suffer the consequences of overcrowded homes, as they lack adequate space to play, study, and develop properly. Imagine a family of 5 crammed into a small 2-bedroom apartment, tensions running high, and children struggling to concentrate on their homework amidst the chaos. This is the reality for many families living in overcrowded conditions, where the lack of space takes a toll on their well-being. Children are particularly vulnerable to the adverse effects of inadequate housing. Their developing bodies and immune systems are more susceptible to the hazards posed by dampness, mold, lead paint, and other housing-related toxins. These environmental hazards can lead to a range of health problems in children, including respiratory illnesses, allergies, developmental delays, and behavioral problems. Moreover, the stress and instability associated with living in substandard housing can have long-term consequences for children's educational attainment, social development, and overall well-being. Ensuring safe and healthy housing for all children is not just a matter of social justice. It's an investment in a healthier and more prosperous future for all. The impact of inadequate housing extends far beyond physical health, taking a significant toll on mental well-being. Social isolation, a growing concern in many societies, is often exacerbated by substandard housing conditions. When people are ashamed or embarrassed about the state of their homes, they may withdraw from social interactions, leading to loneliness, anxiety, and depression. Moreover, the stress and insecurity associated with living in unsafe or unaffordable housing can take a heavy toll on mental health. The evidence is clear: inadequate housing has a profound and detrimental impact on our health and well-being. Addressing this complex issue requires a multifaceted approach, involving policymakers, housing providers, healthcare professionals, and communities themselves. We must move beyond simply providing shelter and strive to create healthy, safe, and affordable homes for all. This includes investing in energy efficiency programs, enforcing stricter building codes, and providing support services to help people maintain their homes. Investing in healthy homes is not just a moral imperative, it's a smart economic decision. By addressing substandard housing conditions, we can reduce healthcare costs, improve educational outcomes, and create a more productive and equitable society. When people have access to safe, stable, and affordable housing, they are better equipped to live healthy, fulfilling lives, contribute to their communities, and reach their full potential. It's time to recognize that housing is not just about bricks and mortar. It's about building a foundation for a healthier and more just future for all.